This presentation was developed by the Department of Health. We have permission to use this for training. Thank you to the COPCO and the Maui District Office. This training and presentation on protective posture and level of protective equipment will be interactive. This means you'll watch this presentation and perform the tasks and skill sets that are being discussed throughout the presentation. You control the pace. Stop the presentation anytime, go back, start again. The main point is to learn how to do these tasks and skill sets. At the end of the presentation, there's a CDC video and a link that runs through the entire process. We hope you enjoy this learning experience. Personal protective equipment is considered protective posture. PPE, or personal protective equipment, protects the wearer from exposure to pathogen or contamination. We are using the highest level of protection that affords us against droplet transmission. We also use a respirator for airborne or aerosol protection. Droplet protective equipment include the use of gowns, goggles, face shields, respirators, gloves. We should also have a biohazard trash bag or receptacle, cleaning and decontamination equipment or supplies, and hand sanitizer. These number or quantities associated with the PPE can change or increase based on your operational needs. By the way, be sure to have these supplies and equipment in front of you as we go through the training. Important terms and jargon are used. PPE is a gown, mask, goggles, gloves, or personal protective equipment. Wearing or putting on the PPE is called donning. Removal or taking off the PPE is called doffing. Sometimes you may hear a provider say, "Hey, don your PPE before entering the room." Means put it on before entering. Or doff your PPE before leaving the room. Remove it before exiting. All right, we are about ready to begin. Or wearing or donning your personal protective equipment. Just follow the numbers. Again, practice as we watch this presentation. Gown up or don your gown. It sometimes helps to pre-tie the neck strap and slide your head through the loop. You can tie the waist strap in front of you or on the side. Keep in mind that this is a gown and not a dress. It should be lightly fitting or loosely fitting, slightly baggy. Are you gowning up or donning your gown? Great. Let's get the mask on. There are many different styles and designs. Hopefully you know your size that fits you. Have you masked? Donned your mask yet? Great. Remember that a respirator or an N95 type provides you highest level of protection. A surgical or procedural mask do not. Make sure your head straps are in the right place. This may affect a proper seal. Also be sure facial hair does not affect a patent seal of the mask. Your agency, department, or employer should conduct fit testing for personnel that are required to use a respirator. And yes, an N95 particulate mask is considered a respirator. Let's don the eye protection. Goggles or eye protection should protect you from droplets. There are many cool looking eyewear, but they do not afford you the level of protection. There are also face shields that cover an entire face. If you have both, you can use both. However, when you start moving, the air you breathe out will fog the goggles and face shield. Try them on. See if this begins to fog up. It's the usual occurrence. Let's get the gloves on or don your gloves. Make sure the gloves cover over the top of the gown. So get those gown sleeves tucked in. Great job. Sometimes we place another pair of gloves over. These are usually a different color so that we can see a tear in the outer glove. Remember, if you have a tear, stop, remove the gloves, and sanitize for 20 seconds and then re-glove. Try now, stand, sit, bend at the waist. See how your mobility, visual acuity, and breathing is affected. Call out for a timeout. If you have a breakdown in your PPE, use hand sanitizer and do not self-contaminate. Removal of the PPE or personal protective equipment is in reverse order. Let's follow the numbers. Let's be very attentive though how we doff our PPE or personal protective equipment. So make sure we have our hand sanitizer, because you can use hand sanitizer for every step that you take in doffing your PPE. Get a trash or biohazard bag because you'll need to place the contaminated equipment in them. Once again, this is a crucial step. Most occurrences in exposure happen during the doffing of PPE or a provider self-contaminates. Take your time not to self-contaminate. If you do, stop and use hand sanitizer and wash for 20 seconds. Now reach under the cuff and work the glove off, rolling it into the other glove. Dispose of your gloves into the biohazard bag. Great job. Try to reach for the strap now behind your head, because the backside of your head has not been exposed and is considered a clean area. If you reach in front or from the side, these areas could be exposed. Don't self-contaminate. Dispose of these items into a biohazard bag. Great job. Don't forget, you can use hand sanitizer between each step. Let's get the gown off or doff your gown. If you do not have gloves and your hands are clean after using hand sanitizer for 20 seconds, pull from the inside and the back side of the gown. The inside of the gown has not been exposed. As you work the gown over the shoulders, roll the gown so that the contaminated side is being rolled in. Once you get it all off, dispose into a biohazard bag, and again, you can use hand sanitizer. Great job. Removing the N95 or respirator, be sure to have clean hands. You can use your hand sanitizer. Now reach behind the head again, as this area has not been exposed. Pull the straps over the head and remove the respirator, dispose it into the biohazard bag. Great job. Sanitize, 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 sanitize. 20 seconds. And at the end now, wash your hands with soap and water for 20 seconds. Great job. Here's reference material you can post. Remember to limit exposure of your PPE. Do not touch your face. Use hand sanitizer and do not self-contaminate. Here's additional information. And go ahead and enjoy this 10-minute video which puts the entire sequence all together. Thank you for your attention and great practice.